Hello, Jota Joti, and welcome to this exciting panel that we have in the health and wellbeing area. I'm Alistair Hannaford, a youth representative of World Scouting in the field of health, and I'm joined by some amazing people today to discuss youth advocacy in health. So for this discussion, we're joined by representatives from World Scouting at the Global Youth Mobilization, Andres Estrada, Montse Lopez, who is a consultant of World Scouting in the Health and Wellbeing Program, and by Hemael Sana, the immediate past liaison officer of the International Federation of Medical Student Associations to the WHO, who in this role was vice chair of the WHO Youth Council, the council that I sat on her with. And today we're going to discuss how our own experience, but also the opportunities of scouting, provide young people with the ability to get involved in youth advocacy and health, and the ways in which you can support your community in doing this. So with no further ado, I'll pass on to Andres to give him an opportunity to speak about how he got involved in advocating for health. Andres, please go ahead.
Thank you, Lester. Well, for me, advocating for health, it's a very important activity to do and a very active goal to pursue. First, my advocacy came as part of a local project and then became a national project in Mexico. It was called Proyecto Sigrid, advocating for organ donation after a dear friend of mine passed away, and her parents decided to donate life to 7 other people. So starting from that onto the next future, onto the next stage, was a path of hard work, trying to create awareness of the importance of taking care of people's health. Then when it comes to the global youth mobilization, after I was invited to participate in the call by the Inter-American Scout Office, I decided that I have no doubt of the impact that I could contribute at that level of decision-making and advocating, especially in times as difficult as they were when it came to the global youth mobilization, because it was at the end of 2020, after we've seen the disastrous impacts of COVID-19 on people's health, on physical, mental health. So I was inspired by all the people trying to make an effort to improve the livelihood and the living conditions of people facing and affected by COVID-19. So I think that's sums up my story.
That's a really empowering and inspirational story that you provided us with on how you got involved. Montse, can I pass it on to you to hear about how you got involved in health advocacy?
Yeah, sure. So I think I got involved in advocacy thanks to scouting. I have been scout for 20 years now, and I'm 26. So since I was little, scouting provided this platform for me to speak up about what I wanted and speak up for things that I was passionate about. And on that note, you grow up with that. I grew up with that platform. And once I entered university, I realized that being involved in health, it was I was really passionate about. I studied microbiology and biochemistry. And at one point, there was an opportunity for me to join these two passions on advocacy and health. World Scouting had just begun their youth reps program, and the health and well-being area was gonna start constructing. So I think it was a combination between learning and empowering myself through scouting, and also outside of scouting, how I can use something like health and study what I studied to advocate for those that need it. My career is very much based on seeing what other people needs, and being involved in a social context in my country. So I think those two passions mix well together and perfectly combined now that we have a health and well-being area.
I definitely resonate a lot with what you've said there. I think the skills that scouting provides to young people and provided to myself do encourage you to go out and look to make a difference in your community, to advocate for change, and it provides you with the tools to do that. And now we turn to Hamael, our non-scout, so to speak, who entered through a very different way. But I am working on getting her in a scarf. Don't worry for all of those at home who feel we've allowed a scout panel to be infiltrated.
Thank you so much, Alistair. And it is an honor to be among the scouts. I have always been fond of my fellow friends who've been engaged with scouting efforts in their communities. And I think if I were to go back to my own experience of how I got engaged in health advocacy, I would basically say it reiterated the same thing that my colleague said just now. But for me, health advocacy started, I would say, when I chose to go into pre-medical education. And I saw that a lot of the education that we were receiving was very didactic, but we did not get a lot of input, or you could say mentorship, on how do we advocate for the diseases we're reading about or understanding on a daily basis. And then I grew up in Pakistan, and we did not have a culture that was a very, you would say, engaging young people in talking about the new discourse about new research coming out on health prevention or healthy lifestyles. How do you make that happen? So I got engaged with the organization that I just graduated from, in a way, last month, the Medical Students Federation, IFMSA. And through that, we sort of built, like you could say, a solidarity of other medical students who also saw how much important it was for young people to advocate for health and to make sure that people understand that this is an area that is really important if we want to make sure our populations are healthy, they're productive, they're economically progressing. And I would say that the people who are listening to this and people in the Zoom call, even, we're lucky people who were able to like find those groups in our communities that helped us like shape these skills and find other people. But I would also say, like, in a way, it just shows how important it is, because we are what we are because of those skills, because we understood the importance of it. Now we can talk about it and inspire other people. But yeah, now on the other side of it, now even as a doctor, I see the importance of advocacy in everything I do, be it in the hospital or outside or in my research or anything. So yeah, it's a fantastic, you would say, privilege to be able to advocate for health.
And obviously you provided a kind of lovely introduction on how you got involved in health advocacy there. Just digging into it maybe a bit, your term on the Youth Council, maybe you'd like to speak to the role of the Youth Council in health advocacy.
I would love to talk about that. So the Youth Council, in a way, I would say, was the next step of the advocacy that we were doing in our local communities. So IFMSA was one of the organizations that were part of the Youth Council. And then we had several other constituencies that were working on different areas of health, like non-communicable diseases or road traffic accidents, and all sorts of things that are super, I would say, relevant to young people everywhere. But we would not have many people pushing us towards understanding why it's important for us to advocate about this in our systems. So working inside IFMSA and then be part of the Youth Council, we started the first ever, you would say, inaugural meeting in the beginning of this year. So it's fresh off the press in some ways, you could say. And the main energy behind is that instead of working in our own silos, so my focus was mainly based in Pakistan. So I was mainly working on non-communicable diseases, chronic diseases, vaccines, access to that. And then I had friends who were living in places that it was very important for them to advocate for road traffic accidents because the roads were not friendly for young people and how they were driving and their driving policies and stuff. So youth council became sort of like a landing ground for all of these people. And I would say the best way to look at it is that it's a network of WHO. So in a way, the advocacy we have been doing in our local communities and our countries is now put on the table where the decisions are made on these health policies. And it's also a way of like getting mentored by each other because we all are in the phases where we're learning and expanding our knowledge each day. So it's like a group where we understand what our problems are, we identify them, and then we put them in a very elaborate, detailed document or a report. And then we have systems inside that can help us like put these problems on the agendas of people who make these decisions or who make these guidelines, because eventually that's the hope that the advocacy we're doing inspires policy, inspires its implementation. So yeah.
I think that's a lovely introduction. And from my side, as a member representing World Scouting, I think it's also a brilliant opportunity to bring together people with medical backgrounds, people representing medical organizations with much broader youth civil society like World Scouting, where actually our work on health is more dispersed than something like IFMSA, but equally is an important strand of what we're doing through non-formal education to empower young people. So I think that's really nice. Now, something you also touched on, which I would like to come back to, obviously your education shaped a lot of the way in which you were able to get into health advocacy. But how do you think your education as a doctor did really solidify this? And what can we learn as Scouts moving forwards to really look at how we embed these outcomes into our work?
That's a good question. Thank you so much for asking, Alistair. And I would say that I see health as a very interdisciplinary field. I feel like till this point, we have done a disservice to saying health advocacy can only be done by people who come from a health background or people who understand how diseases work. Whereas, especially now in this day and age when internet and evidence-based medicine and the advocacy tools that we have on our hands is so easily accessible, I feel like it's an individual responsibility of every person to educate themselves about the problems in their communities and educate themselves in a way that is credible, because we see so much misinformation on the internet about so many disparities and health problems, and that misinformation is dangerous. But of course, we also have good things that are evidence-based research that's coming out every week. We are also seeing like research being very friendly for people to understand in a way. So we see like lay summaries of papers coming out on Twitter and LinkedIn, people sharing, like scientists sharing their findings on internet in a way that people can pick on them and then easily like explain it to their friends that, hey, the screen time is not considered a good thing. So according to this research, this is the limit. And it just makes science so much accessible. So when I started my medical school, I found that health, I was super interested in, so of course I went out of my way to understand how papers like were being written, the language used, academia, research, discussions and everything. But I also saw like a disconnect between what we were doing in our silos, like health in its silo, and then advocacy happening outside. So my education in some ways, especially within my field, that was in global health, I worked with so many other young people who were not necessarily always coming from a health background. And through that, we saw that, yes, our education needs to now shape up in the way that our community needs. And right now, I would say anyone who understands the health disparities in their communities, I don't think we need to have a health background to help us move towards that. Our individual responsibility is that we talk with each other, ask each other questions, and be part of panels like this and listen to people who come from different backgrounds. And I would say, yes, we need law, we need arts, we need philosophy, we need anthropology, we need medicine, we need all of it for health advocacy to come through. And I was, I would say, lucky that I got that perspective. Maybe not through my curriculum that was strictly medicine, because in medicine we still are way behind in getting that in our curriculum, but through non-formal peer-to-peer learning, I was able to see how much benefit it can make. So I would say, yeah, we should always approach our better selves in that way.
That's a really beautiful contribution, and it lines us up perfectly for my next question, which I'll direct towards Andres and Monse, which is, how can Scouting support young people advocate for the health needs of their communities? Maybe if we give Monse the opportunity to start here.
Thank you for that question. I think on the note that we were just talking on how can we get involved on health and empower young people, not only through a professional background on health, but also into their daily lives. World Scouting is now on the process of developing the health and well-being educational area, which involves 4 sub-areas that are healthy lifestyles, mental health, sexual and reproductive health, and personal safety. So we are looking into creating challenges where young people can learn about these topics in a very safe place, even if they don't have health background, or if adult in Scouting they do not have it, they can also empower young people to learn about. But most importantly, how can they take this information and these tools that they are learning into their community, and how can they impact their community by knowing about mental health, by knowing about stigma, by knowing about nutrition and their health rights. So we are trying to empower young people with more and more reliable information and more tools that they can use in their daily life, that they can use while choosing a career on health, or while choosing a career completely out of the health spectrum, but also advocating for knowing how are they feeling, recognizing their emotions, recognizing that health, it's a combination of many factors. So this on World Scouting, we are offering this huge initiative. We'll carry activities for young people from 7 years old until 19 plus. And it's a way to get involved, and it's a way to find your passions. We have programs on environment, on peace, and on life skills. So this is a way for us to say to young people, maybe you're passionate about it. These are some tools that you can learn. These are some things that you can bring back to your community and advocate for yourself and for others.
I think that's so amazing to hear, and I hope that all the young people at home are really excited about this development, and the thought that in a couple of years' time they'll be able to get various different challenge badges, because I know I really like a really pretty badge. That's definitely not the reason I became a scout, I promise. And Andres, I think you've got some really interesting points to this question, don't you? You're on mute, Andres.
Sorry. Yeah, and especially based on my experience in the global youth mobilization and how all these young people from all over the world came to participate in this great project in several ways. I mean, we did offer the funding for grassroots projects, but as well involving in workshops, in conferences, in different activities and at all levels. So I think, and that was part of the discussions we did had at the end of the first phase of the global youth mobilization, that one of the most important things that Scouting will have to offer for young people to get involved, and I think it's in the right track. It had to do first with building skills, with building capacity for young people to pursue their interest in this case in the health field, as Monse mentioned, with all those interesting programs and badges that are for to come. but as well, and I think as well as very important, is building trust and empowerment in young people. And I think that was one of the most interesting outcomes of the global youth mobilization, because it did actually trust young people to be or to become change maker in their communities. Not to become, many of them are already change makers in their communities, but to give them the resources to implement their projects, their ideas. That's a huge way to say, I trust you, young person, that you can make a tremendous impact, and that we have your back. We are here to support you in this field. So that helped not only achieving the goals of their projects, but as well in the long term creating networks of peers and of young people to interchange their ideas, interchange their interests, and come together as well to try to make greater change. And I think that's, as well as part of the global youth mobilization, we try to provide these spaces for young people from different backgrounds, from different fields, from different projects as well, to exchange their ideas, to share their best practices, and how different outcomes could be accomplished. So I will certainly concentrate in those two aspects: building skills, building capacities, and trust and empowerment of young people.
I think there are definitely some really nice outcomes that you bring, which also link into what Monse was talking about the development of broader health programming within Scouting, but also what Hamael was talking about on the importance of peer-to-peer learning and the ability to disseminate these resources among ourselves. So I think that's a really lovely outcome. I think from my experience as well, building on this, Scouting provides immense opportunities for young people to get involved in health advocacy. I became involved firstly at a national level in Scouting, through Scouting becoming involved in the British Youth Council, which allowed me to begin advocacy in Scouting at a higher level outside of a group. But obviously being able to shape what your group is doing is a really important first step to learning those skills, being able to express to your leaders why you want to do something, how you want to do something. If you want to learn more about health, how they can support that. Before I then took on a role at World Scouting as a youth representative, I think the ability of our local Scout groups, our national Scout organizations, but also World Scouting to empower young people, to provide them with access to spaces where they can advocate, is so important to then leveraging the whole movement as a means to creating a better world. Obviously, we have provided everyone at home with so many nice examples of how we've managed to advocate for health in our communities. But I think at this point, it's really important that we then kind of reflect on how they can get involved in their communities and how you would recommend that they best do this. So Andres, I would ask you to start. What advice do you have for people who want to get involved in their local communities advocating for health?
Thank you. I think one of the main advice is that it's going to sound like a cliche, but is that when you overcome your fears and once you overcome your worries about getting involved and being speaking up, you find yourself a nice community of people that are trying to do the same, or advocating for that same for those same goals that you are working on. So for me, it comes first to that, like, to overcome those fears, there will be a community that will hopefully support you. And as well, that there is no, and that as well comes from my GYM background, there is no small action that cannot make a significant impact in a huge or in a wide problematic. So even if you change or try to improve the conditions of one person or one small community, at the long run, it's going to have tremendous impact overall. So yeah, I think I will go for those two.
I think there's some lovely words of encouragement. Monse, what would you like to add to this?
I think I would like to add that don't overestimate the platform that you are advocating in. So you can be advocating in a very global and very public way, but you can also be advocating at home. You can also be talking about mental health at home, or you can also be advocating with your friends about drinking water, for example. So those are the little things that can get you started and can get you hooked up with the passion of advocating and health. There are many different ways of advocating for yourself, for advocating for those that cannot. So don't underestimate where you are speaking or who you are speaking to, and that your voice carries a lot of weight to a lot of people. So even if you feel like you're only talking to your friends or you're only posting on social media for a couple of followers that you have that are your friends and family, that is a platform. And we choose what we do with our platforms and how we express ourselves. So it can either be at a global level or a family level. Every single action towards advocacy on health or any other matter counts.
I think that's so valuable, and I think it links very closely with Andreas's point that those small actions, they really begin to snowball very quickly. And it may just be one conversation that you have, but that one conversation can really lead to very impactful outcomes, either in the life of that person or in you deciding that actually you could develop a broader project. You could look at how this could be implemented more broadly in your community. And I think it's the way that those small things come together that's so important about local level community action. Hamael, I'd like to invite you at this time to answer.
Well, I think Andres and Montse did like a very beautiful summary of what we were discussing. And I would say, I would really echo what both of them said. And in a way, every positive contribution that we're making in our communities is like something that is going to live there for a long time. And I also very like a big believer of lead by example. So every time that we are and like making sure that our schedules include daily taking care of our hydration levels, our exercise, or telling people that you don't need to like go out every day and eat junk food, and maybe we could like invest in having like socials in which we just eat healthy food. So in some ways having a healthier lifestyle be more approachable, accessible, and more fun. I think that is a very much of a jurisdiction that we can take on as young people, because a lot of the bigger pushback that comes about health advocacy is that it is so it's so boring, and this is not the time for us to start caring about our health, and why should we be talking about health when we are like so young? Maybe you'll start advocating for like diabetes or heart problems when we are like in our 30s. And that is, I think, the flawed thinking that we have to get out of. And Monse did a very beautiful thing, that we decide what we do with our platforms, and in some ways all of us here are very fortunate that we do have that platform, we do have those groups. So the best way is for us to show how good it can be, how we don't need those next level scientific innovation technologies to come and save us. It could just be small things, small advocacy efforts that will make our populations happier, healthier, and productive in the coming future.
I think that's definitely a valuable input that you've provided there. I think just on top of that, and it's very easy to think of these as individual things that we can go out and do, but within your scout group, within your school, wherever within your community, you'll find friends who are also interested in these topics. And I think it's so valuable to think about how you can do projects together with your friends, with other people from your scout group, to make sure that actually you are going out, making that small change, but it doesn't need to be something you do on your own. it's best done with other people, with friends, with people that you really want to spend time with, that you really want to help create a better world with. And I think on that, the other side of it almost is, even if you do start out on your own, you meet all these amazing people along the way that you're left with so many friends at the end of it, scouts, non-scouts, people that just want to see change in their community, that it's really empowering to go out there and make a difference because you have a whole community supporting you along the way. On that point, I'd like to thank all of our amazing panelists for their contribution and for their time. And I hope that everyone listening at home enjoys the rest of their Jota Joti and that they found this panel as exciting and inspiring as I did.